Welcome back. My next guest is Charlie Workman, who is Assistant Director for Rehabilitation Services at Baptist Health.
That's correct.
And simply physical therapy, PT, is what you do.
My background is in physical therapy, yes it is.
Now, your bread and butter, at least a lot of our physical therapy referrals, are back and neck pain. But you also do some pre and post-ops type stuff.
We do, yes. We have. We're very proud of the team that we have for our Baptist outpatient clinics. That is not just composed of physical therapy, but also occupational therapy and speech therapy. They treat a lot of musculoskeletal disorders, orthopedic injuries, such as sports-related injuries or work-related injuries, even the post-operative type care from someone that's had a total knee replacement or a total hip replacement. But we also see vestibular type rehab as well.
Do a lot of stuff. So let's talk a little bit about the post-op. Do people get a knee replaced in the hospital, a joint of any kind? You guys see them, do you see them in the hospital? Do you see them as an outpatient to help them get back to normal joint function?
Yes, nowadays it's an accelerated process. So we see them in the hospital, and usually people will stay just a day or two in the hospital, and they transfer very quickly to either home care or straight to outpatient therapy. The rehab is usually 4 to 6 weeks to regain their strength, regain their mobility, and get them going back to doing what they want to do.
Now, you mentioned occupational therapy, speech therapy. Explain the difference between that and physical therapy.
So physical therapy tends to work on the whole body, looking to restore function and mobility of gross motor movements, whereas occupational therapy focuses on daily activities. So somebody that's trying to do some dressing, or if they're trying to brush their teeth or wash their face. So you tend to see those variations in daily activities versus gross motor type activities between occupational therapy and physical therapy. Speech therapy works on more cognitive related and speech impairments. And so oftentimes they're very involved in our neuro population.
Now, you mentioned neuro population. That also includes stroke rehabilitation.
That's right. We see quite a few strokes in the Kentucky region. We're in the stroke belt, and so our outpatient departments offer a very comprehensive program involving physical therapy, occupational therapy, and speech therapy interventions for not just stroke, but also multiple sclerosis and Parkinson's disease as well.
Now, you mentioned those two, and I started the program talking about those two. How is that different, and what do you do to help those disease processes?
So Parkinson's has really evolved in their recovery process. It used to be that people would come 2 times a week for quite some time. Now it's a very high intensity, 4 intensive weeks of therapy where they may come daily for those 4 weeks and work on very big movements. Folks that have Parkinson's disease have trouble moving and taking larger steps and doing larger movements. They also have difficulty with their voice and being able to project what they're able to say. So our program is a big program and a loud program that's provided by our speech therapists, and that allows the patient to progress over that 4-week time to get back to a stronger function than what they were doing before.
You also mentioned multiple sclerosis.
Yes, so we have a multidisciplinary comprehensive team, including a physician, physical therapist, and occupational therapist that will all see the patient on the same day and prescribe an appropriate treatment plan for those MS patients so that they can begin restoring their function and mobility. And so that all happens on an outpatient basis with the physician in close collaboration with our therapist.
Now, those are kind of like what I call bread and butter things, but there are also some things are not unusual, but you don't commonly hear, like dry needling, aquatic therapy. Tell us a little bit about those.
So we have a number of different interventions that we can do for addressing various musculoskeletal components, and dry needling happens to be one of the fastest growing interventions that we see in mainstream physical therapy over the last couple of years. And a lot of that's because the patients love it. They see an almost immediate result. The procedure is actually done by using a small, flexible microfilament needle that the patient can't even feel, but it's inserted into a muscle spasm or a tender point that's often created by maybe an injury or overuse training. And so when you insert that into the muscle, it allows an immediate relief. And so we tend to see great results. Even within one treatment, sometimes it takes a couple to achieve that.
Well, that's great information. Thanks for coming in and sharing with us.
Yeah, thank you.
All right. This time of year, we're starting to see the flu. We've seen a little bit of an increase in hepatitis A, and they can all be prevented by vaccines. Here's some information about vaccines brought to you by Baptist Health.
A vaccine is typically an injection that increases your immune system ability to fight a disease. It makes your immune system remember something, so then if it sees it again, it can fight it. Most of the vaccines that we give are actually dead viruses. They are not going to give you the virus. They are very safe. We have done study after study on thousands of children to adults to be able to have these approved for the FDA. There are lots of different types of vaccines for all different ages, from birth all the way up until age 65, and then kind of periodically recurring things like flu shots. And we want to get them done right when we recommend them because we want to give as much prevention as we can. So having an annual regular checkup is one of the most important things to be able to have your preventative care up to date, and immunizations or vaccines are part of that regular checkup. We want to think about herd immunity even within your house. We don't want things spreading. We think of the flu. We have flu epidemics every winter, and we just don't want things that are more serious that we don't have treatments for that would spread rapidly and cause illness all over the country. You don't want to be a person with a suppressed immune system if we had a measles outbreaks or if we have the whooping cough outbreak, for example. And you also don't want to be patient zero, the person who started it all over the country.